Well, it is important to know that PGTA does not guarantee the birth of a healthy baby. But yes, we have greater chance if we have the if we have under if we have made a test. So women who become pregnant are advised in some cases to undergo prenatal testing to confirm PGTA results. It is important to go to our to the consultation and to the checkups to see how's going the pregnancy. There are some advantages and disadvantages of the PGTA. So it is important that the advantages for me is that it reduces the risk of having a child with a chromosome abnormality that is related more due to advanced maternal age. Another pro is that for women who have had unexplained miscarriage, PGTA can reduce the risk of future miscarriages. Also, PGTA can reduce the risk of having to make difficult decisions about whether to terminate or continue pregnancy, where the fetus has a chromosome abnormality, and also for women over the age of 36, PGTA can reduce the risk of miscarriage and the number of embryo transfers to achieve a pregnancy. So we have already seen that it could be recommended in women over 35 years old. In women and younger, we haven't seen any advantages if they go through a PGTA test in case, if, for example, if they have any background, for example, miscarriages, for example, some genetic abnormalities, and for example, some failures. They can go through this test, but this test is not for everybody. So that means that it does not increase the overall chance of having a baby. That is important. PGTA is not for everyone because it's expensive and is an addition to the cost of IVF, and it is not covered. It is not covered. This study. Some embryos may not survive the biopsy procedure. All the embryos should go to these biopsy procedures, and then they are sent to the genetic center to study the aneuploidies of the embryo by NGS. Due to technical challenges, there is a very small chance that the test results may not reflect the true health of the embryo. So that is important that this biopsy is done in the trophoectoderm. So it is not done in the embryo. So some embryos may have a normal and abnormal cells. So this mixture is called mosaicism. So we have seen this in these years with the PGTA results. This can cause a false positive or a false negative PGTA result. If we have a false positive result, means that the few cells that are tested show abnormalities, while the remaining cells are chromosomally normal. So based on the result, an embryo that may have led to the birth of a healthy baby may be discarded. So that is why I think that PGTA is not for everybody. We can discard some good embryos because of this positive result. So we should point out which patient is a candidate to undergo this process. On the other hand, we can have an false positive result. That means that the few cells that are tested are normal, while the remaining cells are chromosomally abnormal. Based on the test result, a chromosomally abnormal embryo may be transferred, but it's very rare. So sometimes no embryo is suitable for transfer. So in that case, we discuss with our patients the results and the options that we should follow. And in some cases, embryos may not survive the thawing process if they are going through a PGTA test.